providers of Minnesota's The Inside Scoop with your advocacy team, Toby Pearson, Aaron Bowie, and Todd Bergstrom. This week's guest host, Patti Cullen.
Good morning. My name is Patti Cullen. I'm a substitute host for this week's issue of Inside Scoop. Substituting for a couple of reasons. One, it's a really busy week at the Capitol, so the lobbyists are up there. It's first deadline week, and even though all of our issues are advancing nicely and are meeting deadlines, there are a lot of bills we are working on amendments to, state agency bills, for example, bills relating to studies and home and community-based services settings rule, all kinds of issues. So our lobbying team is up there, and we will summarize some of the activity in this week's newsletter, so feel free to read that. But I want to focus on what's going on in Washington, D.C. So in addition to having a couple newsletter articles this week, we have a new section of our website here that lists some of the resources and materials on the American Health Care Act, which is also known as the Obamacare Repeal and Replace Act, which is moving forward. And we're, of course, very, very concerned about that and how it ties into any state funding. It's estimated that close to $2 billion of federal funding will be at risk for Minnesota, beginning as early as October of this year. The per capita payment proposal is a little bit complicated, but in essence, the big part about repeal and replace Obamacare that we're watching very carefully is really the funding mechanism for it. In order for the provisions to be paid for, they wanted to do a Medicaid reform. So what happened yesterday into the early hours of the morning is the House Ways and Means Committee and our own Congressman Paulson voted to approve the sections of the Obamacare repeal relating to tax relief. So the proposal, the 100 and some page proposal that was introduced Monday of this week on the 6th, was divided into two separate bills. Ways and Means just voted in a 16 to 18 hour marathon session that ended this morning about 4:30, voted on the tax provisions, and it passed out of that committee on a party line vote. As I speak to you today, the Energy and Commerce Committee is dealing with the Medicaid reform portions of it. Those are the things that have the greatest impact on Minnesota. We are one of 19 expansion states, which means the big portion of Medicaid on the short term that they dealt with was decreasing the federal match for the expansion states. So from a 95% federal match to an 80% federal match immediately, and then phasing out the whole expansion program in 2020. That's a big deal. 1 in 5, we have 300,000 plus Minnesotans covered under the Medicaid expansion program in Minnesota. About 1 in 5 receive mental health or substance abuse services, so it's not necessarily what we call the working poor. The Department of Human Services has put together data sheets as well as summary documents of what per capita cap could mean for Minnesota. They have a separate website here that you can access all this information. We have posted those on our website as well, but if you wanted to go directly to the Department of Human Services information. So your national association is working with the state affiliates day and night in doing meetings and summaries and alternative language and meeting with leadership in the House and Senate, putting together an analysis on what it means for our sector. So rest assured that your national association is working day and night to try to figure out how can we prevent this from passing and being signed into law. And if we can't prevent it, how do we make it livable? And how do we make it acceptable for our sector? So those are pretty big challenges that they have. And we have had multiple conference calls with them to give input and guidance and to figure out what's the next steps. So we have sent special emails to members in Congressman Paulson and Congressman Emmer's district. If you haven't reached out, even though the initial Ways and Means vote is already gone, now's the time to reach out. It will go to the House chambers for a full House vote before their Easter break, April 6th. Even if you have Democratic representatives, send them messages about how you think cuts to your program will impact your ability to take care of Medicaid populations. We know there's nearly 40,000 seniors every month taken care of in our settings that are on Medicaid. We understand the implications, but make sure your members of Congress know how upset you are about it. So, the big issue that we're going to have, should this per capita cap pass, is not just that we're going to have less money in this state. We will. We will have, there's right now, given the timing of this action and their desire to be done and have it passed both bodies by April 6th, means our legislative battle to get any funding for our initiatives is up in the air. There are no budget targets that have been released yet because, frankly, they want to wait and see what happens to the Medicaid program nationally to see how big is the hole that we'll be looking at for the next biennium. So our state issues are going to be tied to the pace of the action at the federal level for sure this year. Secondly, if per capita caps passes, it means a whole new dynamic. Everything can change. Everything will be up to states to decide. States will be given a lot of flexibility in exchange for less money. So there will be ability to change services that are paid for, which is mandated, which is not mandated. They could change eligibility criteria. All kinds of things could be changed in the Medicaid program, a real sea change. So we will be ready to take action if and when those actions pass. But for today, the message to you is get a little bit familiar with what a per capita cap program means, just in case. Follow along with our newsletters, articles, and the emails we've given. Sign up for the AHCA NCAL CapWiz program here. Easy messages already crafted for you, and really it ties to hearing from constituents. So those are the action steps today. We will continue to give you updates as we go forward. If you have any desire to join me in any trips to DC, send me an email because I will be doing a little bit of East Coast adventures in the next few months, multiple times. On the other side, I want to end with a little bit of hope. To the extent that there's a lot of negativity going on, there are also some opportunities for some regulatory relief for our profession. And the American Healthcare Association senior staff have been meeting with CMS and legislative leaders to say, listen, you're going to do all this work on this side, but you also have an opportunity to make it a little bit easier for us. And there are about 6 different areas that we have already been meeting with the leadership at CMS and the congressional offices to say, you can take care of some things for us, whether it's therapy relief, observation stays, 3-day prior hospitalization, requirements of participation, payroll-based journaling. The list goes on and on. So I leave you with some hope that with this pile of uncertainty with funding, there's also an opportunity to have a little flexibility built into our systems. So that's this week Inside Scoop. And feel free to reach out if you have any questions, but take a look at some of the website links that we've provided you today. Have a good week. Talk to you next week.